Hi, everyone. Welcome to today's webinar, where we're going to hear from speakers from British Columbia's Ministry of Health, who are going to share the story about the development and key components of the recently released British Columbia Population and Public Health Framework, which is grounded in a structural and social determinants of health approach. My name is Nandini Saxena. I'm a knowledge translation specialist with the National Collaborating Centre for Determinants of Health. I'll be opening today's session. And once our speakers have shared their presentation, my colleague Jonathan Heller, a senior equity specialist with NCCDH, will facilitate the Q&A session. So just a few housekeeping items. Our conversation today will be recorded and it'll be shared with registrants via email and posted on our website. I invite you to use the chat box that you'll see at the bottom of your screen for conversation and connection with everyone. And you can start by introducing yourself and where you're from. And Jonathan and I will moderate the chat box and we'll share any relevant resources in the chat box as we go along. And you can also use it to share resources that you may have and that you'd like to share comments with everyone as well. And for specific questions that you have for the speakers, you can post those in the Q&A box, which is also found at the bottom of the Zoom screen. And if you'd like to have closed captioning, there is an automatic Zoom closed captioning function, again, at the bottom of your screen, which you can press to turn that on. So to start us off, I'd like to share a land acknowledgement. And the key elements of the National Collaborating Centre for Determinants of Health land acknowledgement that you see up on the screen now is that the 1725 Treaties of Peace and Friendship between Mi'kmaq and the Wolastoqiyik peoples and the British Crown do not deal with the surrender of lands and resources. Instead, they recognize Mi'kmaq and Wolastoqiyik title and created rules for what was intended to be an ongoing relationship between nations. For myself, I'm joining from Treaty 13 territory, which is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And it continues to be home to many Indigenous peoples from across Turtle Island. Treaty 13 was established in 1805 at a time when Black people, forcibly brought to Turtle Island through the transatlantic slave trade, were enslaved or actively resisting enslavement, and when enslavement of Black people was a common practice among members of the early Upper Canada Legislative Assemblies, now known as Ontario, and documented between 1792 to 1800. As a bit of background about the National Collaborating Centre for Determinants of Health, we are one of 6 national collaborating centres funded by the Public Health Agency of Canada and created post-SARS. Each centre has a particular focus, and our focus is to support public health to take action on the structural and social determinants of health and to advance health equity. And as referenced in the land acknowledgement, we're located in Mi'kmaq, now known as Nova Scotia and hosted by St. FX University. So on that note, I'd like to welcome and introduce our 3 amazing speakers. So first we have Dr. Megan Thumath, who is Executive Director with the Strategy Planning and Evaluation Population and Public Health area in the BC Ministry of Health, and is also a Clinical Assistant Professor at UBC. And then we have Lara Miramontes, who is a Senior Director with Public Health Planning and Strategic Initiatives, also with the BC Ministry. And then we have Justine Waddle, who is a manager in the same area, public health planning and strategic initiatives. I just want to mention that we have an ongoing NCCDH relationship with all the speakers, and going back to a 2023 Health Equity Frameworks review that we conducted in partnership with the BC Ministry of Health, and also around health equity strategies. So now I'll hand it over to Lara to kick us off.
Wonderful. Thanks so much, Nandini. Thanks for the great introduction. As Nandini said, I'm joined by Megan and Justine, and they'll announce themselves when they start their sections. So nice to see many logged on folks today, although we can't see all your faces, but we're very grateful that you joined us today. My name is Laura. I'm Chicana with mixed ancestry, and I've been grateful to support this work in the Population Public Health Division in the BC Ministry of Health for about the last year and a half. But I think everyone here would really acknowledge that we're very much standing on the shoulders of giants. So giving lots of gratitude to the team members and partners who've been involved in this strategic work for a decade and longer. So thanks very much for allowing us to speak about this today. We can go to the next slide. Great. I saw many people acknowledging in the chat where they're located. And similarly, I'd like to give special recognition to the place that I'm calling in from today, Cooksappsum or Esquimalt Nation, where I make my home with my family and build connections and heal and grow in this beautiful territory. I'd also invite you to just continue to ground yourself. And there's lots going on in the world today, so encourage yourself to stay comfortable and nourished and stay present. I know it's morning in BC, it's afternoon in Ontario and other places across Canada. So please do what you need to do to take care of yourself during this hour that we have together. We can go to the next slide, please. Thank you. So if you've perused the BC Population Public Health Framework, you'll see that we do have a strong principle of truth, rights, and reconciliation that grounds everything that we do. First Nations territories stretch to every inch of this province in British Columbia, and inherent rights are rooted in the connection to lands and waters and have never been ceded or surrendered. We also acknowledge that all First Nations, Métis, and Inuit have inherent rights that are reflected constitutionally in Aboriginal rights and title, and the human rights that are enshrined within UNDRIP and the Declaration Act in BC, as well as the inherent rights from the Creator. We're very grateful to be able to reflect these teachings from Dr. Danielle Bain-Smith, who's the Deputy Provincial Health Officer of Indigenous Health in BC. You can go to the next slide, please. Great. So just quickly, today we'll have an overview of the BC health system for those that aren't familiar with the BC context, and then we'll jump into the population and public health framework that was recently announced. We'll talk about the development process and then the key components, including a beautiful ecosystem model that we've been grateful to develop here today. We'll also talk about next steps, implementation, measurement, and evaluation, and very interested to hear some questions at the end if you have some interesting jurisdictional questions from other areas. You're welcome to go to the next slide. So at this point, I would ask for folks to join on Slido either by typing that URL into your browser or using the QR code. And using that code there that's listed, we just want to ask a quick question for some context gathering. So we're asking, which area do you work in, to give ourselves a little bit of an idea of the audience and how we can tailor this. Great. A few folks already from public health, so I don't need to explain public health in detail yet. Lots of folks in government, working in healthy communities, different government jurisdictions, some academics, nonprofit, mental health, substance use, immigrant and refugee health, health promotion, some folks from higher education, universities, social work. Fantastic. This is so great to see. So essentially what I'm seeing is a reflection of the broad, comprehensive population public health partners. So that's not a surprise, but I love to see the intersectoral ways that we're all interested in this work and collaborating in this work. Wow, we have some folks even from outside of Canada. We have someone from New Zealand. That's wonderful. So wonderful to see everyone from diverse areas. Fantastic. I think we can go to the next slide. Thanks so much. So for the benefit of those that aren't in BC, and so for those that aren't in the benefit of the BC health system, I'll just give a very brief overview of the system that we have in BC. Folks might know that we have regional health authorities in BC who are responsible for delivering the health services to meet the needs of their population. You can see the map. That's just the regionalized health map there. So quite a broad span of big geographic areas, smaller geographic areas that have more dense populations. And as you can understand, lots of diversity within those areas. We also have two province-wide health authorities. So first, the Provincial Health Services Authority, or PHSA, provides province-wide specialized health services. And in public health, our really important partners that are PHSA agencies include the BC Centre for Disease Control, Perinatal Services BC, and Child Health BC, just to name a few. Also in BC, you may know that we have the First Nations Health Authority. So in 2013, through the Tripartite Framework Agreement, FNHA took on the health programs and services from previously from Health Canada, now from Indigenous Services Canada, in BC First Nations communities. FNHA operates through the First Nations Health Governance Structure and works through 7 directives, which include the directives of being community-driven and nation-based, and increasing First Nations decision-making and control. Also in our ministry, we have comprehensive partnerships with other communities and nations, Métis Nation BC and their 39 Métis chartered communities, and the BC Association of Aboriginal Friendship Centres and their friendship centres throughout the province. At a provincial level, our ministry, the Ministry of Health, works for overall responsibility to ensure quality, appropriateness, and cost effectiveness and timeliness of health services are available for all people in the province. And our division specifically, Population and Public Health, works to provide strategic leadership and oversight in delivering population public health policies, programs, and services, and work towards reducing preventable and unjust differences in health outcomes. We also have a very strong partnership with the Office of the Provincial Health Officer, who has unique and special authorities for public health as BC's Chief Medical Health Officer. Hopefully that's a great overview for those, a little snapshot for those that aren't familiar with BC. We can go to the next slide. So in this slide, we just wanted to demonstrate that actually public health, population public health services do impact all of us every day. I bet within the last month or two, you could think about whether it's you or a family member or a community member who's accessed a population public health program and service, or where it would have been useful potentially if you didn't have access to it, whether that's immunization, education, and health promotion in schools, clean and safe drinking water, perinatal or parental services, preventive screening, and more. So what we really want to drive here is that population public health impacts all of us every day, and that public health really does have a strong service delivery mechanism within BC. Public health, as we know, is the subset of healthcare that focuses on these protection and promotion of health and preventing disease, illness, and injury, whereas population health is an approach that focuses on the underlying factors and determinants of health of populations over the life course. So there's a little bit of a distinction of the definitions there. We can go to the next slide, please. On this slide, what we really want to mention is that population public health does have a direct impact on the health system and system utilization. So for instance, if we can prevent an injury, provide an immunization, prevent or delay or mitigate a chronic disease, and provide safe drinking water and food, hopefully we're mitigating the impact of a person, avoiding hospitalization or avoiding a utilization of a service that would be a little bit downstream. It was really important for us to work from the evidence base and demonstrate the value of population and public health in our framework. So I would direct you to the framework. We have a great introduction there that is targeted not just for the public health audience, so lots of folks in the audience today who are public health experts, but this is also geared towards health system leaders and policymakers. We thought it would be really important to emphasize that strengthening population public health is not only good for the system, it's also the right thing to do for people and populations. And so we were grateful to be able to carve that out in the framework. We can go to the next slide, please. Great. And lastly, this is the big reveal. So the beautiful title page of our BC Population Public Health Framework, Strengthening Public Health, recognizing a little busy bee pollinating across the system, was released in 2024. The framework establishes a new long-term vision, purpose, and strategic direction for population public health in BC. And it actually replaces a previous strategy that was released in 2013 called the Guiding Framework, which some folks may be familiar with as well. The new strategy has several key components, including a new set of priorities and foundational principles. It emphasizes prevention and action on the key determinants of health and helps shape the health of the population in BC. And it really emphasizes prevention of disease, illness, and injury, as I was speaking about on the last slide. You will see a beautiful ecosystem visual very shortly. So just really wanted to emphasize that the framework is reflected in this beautiful ecosystem, which is intended to really be interconnected and show the flows of the system and the ways that we can shape population health. So with that, I'll turn it over to my colleague, Justine.
Thanks, Lara. Hi, everyone. My name is Justine Wardle. I'm a manager on the Public Health Planning and Strategic Initiatives team. And I've been supporting this work to develop the framework as well. I'd like to thank the other members of our team as well who have really been critical in this work, and many of them are tuned in today as well. So the process to develop the new framework began in 2019 as part of a larger initiative, which we've called the Strengthening Public Health Initiative, really focusing on looking to strengthen the whole system and ensuring that we have the capacities in place to maintain and sustain a strong public health system. The initiative was led by the Population and Public Health Division within the Ministry of Health, as well. It was sponsored by the Assistant Deputy Minister of Population and Public Health and our Provincial Health Officer as well. The work was informed by a variety of different inputs, including research, lessons learned, and population health data, which I'll tell a little bit more in a moment. But we wanted to share that it was a very iterative process involving a lot of different engagement and different components as well over the process of the 4 years. We use a number of different strategies for engagement. So we conducted in-person engagements, large community in-person engagements, online engagement. We also conducted some online surveys, as well as accepted written submissions from our key partners as well. It was really important to reach a broad range of partners as much as possible, and really incorporating input from different partners along with the process. In terms of governance, we established several existing committees as being key advisors to the project. We have our Public Health Executive Committee in British Columbia, which is the highest level of public health committee, including our Chief Medical Health Officers, our Vice Presidents of Population and Public Health across the health authorities, as well as our Provincial Health Officer and our Assistant Deputy Minister of Population and Public Health as well. We also established a steering committee with similar members from the Public Health Executive, as well as the Provincial Health Officer or Deputy Provincial Health Officers and Medical Health Officers. For the monitoring and evaluation components, we worked with a monitoring and evaluation committee working group consisting of epidemiologists, data experts from the Ministry, Office of the Provincial Health Officer, health authorities, and BC CDC. And they've been really critical and continue to meet to develop the monitoring and evaluation framework, which is in development. As well as we worked with our other existing public health subject matter committees, such as our policy advisory committees and working groups, as well to get more subject matter expertise. As I said, the framework development was really informed by a number of different inputs, which are outlined on the screen. So we worked early in the project to conduct some evidence reviews and jurisdictional scans. One of those evidence reviews was the equity framework, which Nandini mentioned early on in the presentation. We looked at public health frameworks from other jurisdictions as well to see what were some of the emerging trends in public health, how were those strategies set up and organized, and that really helped to inform sort of our vision for the project. We also considered lessons learned from the pandemic. So, at the same time, our public health partners were actively engaged in the pandemic response, and so that really shaped some of the challenges and some of those opportunities that we saw going forward. And we also considered the previous strategy, which was developed in 2013 and was really a guiding document for public health in the province. And then we led a very extensive engagement process as well. So we engaged with partners from the health system, from our regional health authority partners, from our provincial health authorities, including the BC CDC, other PHSA agencies as well, and the Office of the Provincial Health Officer. As well, we consulted with other divisions within the Ministry of Health, including our sort of data divisions, climate change as well, and really I worked with those partners to help inform the strategy. And then, as Lara mentioned, we worked with other partners as well, including partners from Indigenous service organizations, community-based organizations, our Professional Association for Public Health in BC, academia, and research as well. Next slide, please. As part of the development of the framework, we also completed an evaluation of the previous strategy. So in 2013, the first provincial strategy for public health was released. It established 36 measures and targets, which were across different areas of public health. And so as part of this work, we conducted an evaluation of the progress towards those measures and targets as well. Findings from that review indicate that there are some areas of improvement in population and health in British Columbia. For example, we've seen some positive trends in commercial smoking rates, smoking in pregnancy, for example, hepatitis as well. But there's also areas where we have continued to have challenges. And so as we move on to the next stages of the project, we're continuing to look to areas where we can improve this component. So that includes looking at how we can further disaggregate data and really help to identify and understand how health inequities exist within our province as well. Next slide, please. So this is the ecosystem which Lara mentioned, and it's really our sort of guiding image which unites all of the aspects and components within the framework. And so I'll walk everyone through the image. Starting at the top, we have our vision, which is really sets our where we're trying to go within the system, and that is that people and communities are empowered to achieve their best health and well-being. We wanted to embed that language of empowered. It came from our partners to really focus on a sort of a strengths-based approach. Below our vision is our purpose, which is to promote population health and reduce preventable and unjust differences in health. And that really aligns with our health equity language, which is embedded throughout the framework. At the very bottom, we have our foundational principles, and we're considering these as cross-cutting sort of lenses that we apply to all areas of our work. They're really the roots of the system, and they're things that we really need to embed and continue to make progress in. And you'll see that those three principles are truth, rights, and reconciliation, health equity and anti-racism, as I mentioned, and system capacity, which is really around strengthening the system itself. Within the ecosystem, we've also included our core functions, and I'll speak a little bit more to those, and our enabling functions. And those are those strategies and building blocks, which are part of the system, and that's how we do our work in public health. And then we have our 6 priorities. And then at very top of the image is our determinants of health. So partners really wanted to recognize the importance of addressing the determinants of health as being a really critical component to improving the health of the population. So we've included 3 broad categories which align with a new model which has been developed. Megan will speak to that a little bit near the end of the presentation, but we really wanted to articulate a determinants of health approach in the ecosystem. So it's right there within the picture. I want to acknowledge as well some of the artwork. We were really thankful to have Coast Salish artist Andrea Fritz, who provided some of the Indigenous imagery, which is in the framework, and it really speaks to the interconnectedness of health, the connection of health to land and water, which is really sort of critical to our health and well-being. And you'll see we have that embedded through imagery like the flower, the animals, and the people as well, and the water and land as well. So yeah, and as well as our acknowledgement at the bottom. So I think next slide, please. So I'll just walk through the components, but I won't speak too much of it since they're right there embedded in the ecosystem. But at the top of the framework, or the ecosystem in the framework, we have our vision and purpose. That really reflects that big picture of what we want to achieve, of having people and communities empowered to achieve their best health and well-being. And then we have our purpose statement, which is how we'll get there together as a system. In our previous strategy, we used the language of a mission statement as opposed to purpose, but for this strategy, we decided to use purpose instead, which is really to avoid and lean towards a more decolonizing approach to our language as well. Next slide, please. As I mentioned earlier, we have 3 foundational principles, which are the roots of the ecosystem. And these reflect our overarching lenses across all of our work and priorities in population and public health. 3 principles were identified, first being truth, rights, and reconciliation, which I'll share a little bit more shortly. Health equity and anti-racism, which is really focused on our work to address the determinants of health. And then system capacity, which is centered around strengthening those core functions and enabling functions in order to improve the health of the population. Next slide, please. So as I mentioned before, truth, rights, and reconciliation is identified as a foundational principle in the framework. First Nations, Inuit, and Métis peoples have inherent rights to health and well-being. And since the development of the previous strategy in 2013, there have been several key reports and legislation in British Columbia which outline the actions that government needs to take and the health system as well needs to take to uphold the inherent rights of Indigenous people and address systemic racism within the health system. These include the Declaration on the Rights of Indigenous People and the In Plain Sight report as well. From the beginning of the project, advancing truth and reconciliation was identified as being a critical priority for this work. And so we've done our best as a team to embed that in all areas. We completed a review of foundational commitments. Those include other reports, which outline recommendations that Indigenous people have already made to government and the health system. And so we've looked at those and continue to use those as we think forward to developing actions in the next phase. We engaged with Indigenous service organizations as well through targeted and in-person engagements. And we also consulted with an Indigenous advisor in British Columbia who provided some support with engagement and helped us to do some internal work within our division to understand what we can do as a system as well. We also consulted and sought advice from our colleagues, including our provincial deputy health officer of Indigenous health, and continue to consult with Indigenous partners as well in the next phase. We recognize as a team that this is ongoing. This requires an ongoing commitment to prioritize this work and embed it through all aspects of the project, including how we engage with partners, how we develop actions in the next phase, monitoring and evaluation, and other areas. Next slide, please. So on this slide, we have our 6 priorities for the framework. These priorities really reflect areas where sustained and coordinated action are needed to improve population health. I won't read through the statements, but for each of the priorities, we've identified a goal statement and included a description within the framework as well. And at the very bottom, we have embedded our 3 principles as well to acknowledge that we really need to apply those as we think about these priorities going forward. Next slide, please. And this slide outlines our prioritization matrix, which is really a guide that we've used to help guide our decision making and how we prioritize the different priorities. This was developed and adapted from a resource which was developed by the BC Centre for Disease Control and the Office of Provincial Health Officer. And it really considers both epidemiology as well as other factors like how the role of public health, our own government and strategic direction, and considering all these things and how we determine what we need to focus on as a system. Next slide, please. So we'll take just a quick pause for another question. And we were wondering if you could navigate back to slido.com, and the code is on the screen. And we're curious to know which of the priorities or principles are you most interested in as well. So give everyone a minute or two to respond, and then we'll see. Well, looks like there's a little bit of shifting, but it sounds like there's about a quarter responses are the focus is on health equity and anti-racism. So that's really interesting. And I think Megan will speak a little bit about that as well in the next few slides. I'll give everyone another maybe 10 seconds, and then I think we'll move on. And interesting, climate change as well as best start in life as well are kind of the second place as well. Okay, let's next slide, please. We'll move on. So the last major component of the framework is the functions. And so as part of the development of this strategy, our team also updated a set of core functions for the framework. And so this process involved looking at other strategies that are have been developed, other frameworks for the public health functions, considering our previous functions as well, and then engaging with our population and public health partners as well. 2 types of functions are identified in the new framework. We have our core public health functions, which are those key strategies or activities that public health uses to improve population health. And then we have enabling functions, which are more of the building blocks that are needed to support the delivery of core functions as well. And these are integrated into the ecosystem itself. And then we've included descriptions as well in the framework as well for more information. Next slide, please. The development of the functions was really informed from a number of different inputs. So we looked at our previous guiding framework strategy, which was released in 2013. That document outlined a set of core public health functions as well. And they really organized around those programmatic areas within public health, like healthy living and healthy communities, child and family health, which is the flower diagram on the screen. We also considered some new function frameworks, which had just been released as well. So in 2021, I believe, we had the Chief Public Health Officer's report on the vision for public health in Canada, and that identified a new set of core public health functions, as well as there was a crosswalk analysis developed by the World Health Organization in 2022. And so we looked at those to consider the definitions of within those frameworks and adapted those to our context in BC. We also talked with our public health partners within the province, and they shared with us their feedback, and which we considered as we adapted our own as well. Next slide, please. So on the slide, we have the core public health functions, which are those key strategies that public health uses to improve population health, as I said. In total, there are 6 functions, and we've organized them around the promote, protect, prevent language. That was really carried over from our previous strategy, and that really resonated with our colleagues in public health as well. So we maintain that structure within this new set of functions. A couple things that are sort of new or different potentially. So as you may know, in the Ottawa Charter, defines health promotion and healthy public policy are sort of integrated as one. But within our core public health functions, we've decided to pull out healthy public policy as its own function to really elevate this area where we want to work more. We've also identified public health intelligence as a cross-cutting function. It's really necessary in all areas of public health and supports all functions. So that's across all, it's sort of cross-cutting as well. We've updated the language. This function used to be called population health assessment and surveillance in our previous strategy. It's now called public health intelligence to align with more new language as well. Next slide, please. And finally, we have our enabling functions, which are really those building blocks which include things like workforce, data and analytics, resource management. And we really see these as areas where we need to strengthen them, and they really support, the system to do the work that it needs to do in order to ensure it has the capacity as well. So I'll turn it over to Megan now, and Megan will talk a little bit about the determinants of health piece as well. Thank you.
Great. Yeah, hoping to leave time for questions too. So I'll go through these fairly quickly, but always happy to follow up after. So Megan Tumas, she, her. I'm a Irish and Scottish settler on Squamish, Musqueam, and Tsleil-Waututh territories, just to locate myself and where I am in this world. And I wanted to talk to you about determinants of health. Be very familiar to this audience, but particularly why develop our own in British Columbia. And so you'll recognize some of NCCD's handiwork here. They were consulted heavily and helped us think this through, but we wanted to have one specific to British Columbia that was useful for other ministries within the government of BC and potentially some of our health authority and community partners. So hopefully you'll recognize this. And even I would say the process of building it together was incredibly useful and helped us really wrap our brains around what impact determinants of health have on health outcomes. And so with this, I think we're really centering the principles of health equity and anti-racism in the model, and really hoping to articulate for all of our partners and for ourselves why this work is so important. And so from left to right in the purple, you'll see us articulating the what we mean by structural determinants of health in BC, and the importance. I saw some questions about power and empowerment, and yes, we do have, governance and self-determination reflected there, the importance of culture and societal values. And then when you move to the green, we've got our social and ecological determinants of health, critical for achieving good health. And then I would say what I think is most important, building on some frameworks that we saw nationally, particularly from our Chief Public Health Officer and PHAC, was this concept of the unequal and unfair and unjust differences in health. And so you'll see here we articulate how priority populations really experience the compounding effects of increased exposures, but they're also less likely to have the resources needed to recover or to rebuild. And so this is sort of that intersectionality lens, but applied specifically to population and public health work. And if we're able to improve these determinants of health, then we see healthier societies with reduced inequities, and we see improved health of all people. And so that was really our goal with this. And as a street nurse for many years working in the downtown east side, it certainly was really familiar to me, but I often had trouble articulating exactly why the system was so unjust and unfair for my clients, and why programs like harm reduction that really meet people where they're at are so crucial. Next. And before we jump to questions, we'll just walk you through a few slides on what's next. We've just shown you, we've actually broken up the process, which was an interesting learning when Laura and I initially came by in the last kind of year and a bit to help with this framework. It was sort of stuck because people were trying to build a framework, an action plan, and an M&E plan all at the same time. So we decided to break it up into 3 components so that we could get at least the first sort of high level vision, mission, values, and sort of we've taken on the new learning of removing mission, but our sort of values and our sense of what we wanted to articulate and what is population and public health for people in British Columbia. So we broke it into 3. So that now means that our action plan and our monitoring and evaluation plan is coming up next. So we're working with a really broad sector of partners. And if you're one of our partners on the call, don't worry, you haven't missed an invite. We're just starting to kick that work off in close partnership with PHABC. So we'll be leading a very broad collective impact approach where we're focusing in on different priorities at different times and taking lessons from IHI and our colleagues like our Rural Health Network have been doing Pentagram Plus and a number of other different strategies, and really understanding how can we advance these population and public health priorities. With that, of course, comes very fun and complex work on indicators. If you're a bit of an indicator nerd like myself, you know that's really important work and complex. So maybe I'll flip to the next slide. I think I have an example of our logic model of how we're thinking things through. So this is just an example to provide for our partners as we're starting to work through key actions. So you'll see we've got best start in life. What does that mean to us? Building the foundations of good health by reducing unfair disadvantages for pregnant people, children, and families. And then we've sort of humbly put forward a few potential indicators and targets, again, not finalized, just for people to help think through what we want to work on together. And our goal is to bring the population and public health sort of sector and community partners. I saw questions about patient and family involvement, absolutely, together to really sort of critically examine some of these sample targets, potentially critique them and provide others. And of course, we have objectives that we're refining. There are already many objectives in the framework. They're quite high level, though. They're not, if you're a fan of SMART objectives, you'll notice they're not super specific. So we're trying to get a bit more specific around time. What exactly do we mean? And then to articulate actions. And so we have the early days of an action plan for population and public health and Ministry of Health. So starting with kind of our own house in order, and then we'll be moving to working on the intersectoral collaborations and then collaborations with our health authority partners. Next. And we've been using might be of interest methods wise, we've been using things like thought exchange, and that's been really helpful. Hopefully, if you're in BC, you might have participated in some of our early thought exchange work on the action plan. So we are certainly continuing to collate and take all that great wisdom that we've been getting from our partners. Again, not final example for illustration only, but wanted to kind of mock up what it might look like at the end. And this is an example of our dashboard that we're starting to think about what might some system level indicators look like. Again, there's some really important national and federal work that we're building off of, and some really fantastic work done by the First Nations Population Health and Wellness Agenda. So we're looking at indicators that have already been spoken about and really workshopped with communities and that we know already have some buy-in, and where can we sort of leverage those to have at least an at-a-glance dashboard to help us see are we on the right track for our priorities. We're also, though, knowing that these types of dashboards, one of our colleagues called it dashboarditis, it's unclear exactly how useful they are. So we're also working on an annual report. And Dr. Sarah Fielden is our M&E evaluation lead, and her team are really working on exploring case studies, storytelling. How are we really going to know that we're achieving the aims we're hoping to aim? So we're looking to really mix that qualitative and quantitative mind and learning from Dr. Gwen Phillips and many others in the space who've been schooling us very rightly so on issues of Indigenous data sovereignty. So we're still working through all that. So if partners have good examples of where they've done this work at a provincial level, if there's other provinces or countries on the line, we'd love to hear from you, because that's such a key part of the work in order to do it in a good way. Next. Justine pulled this, and I thought it was very cool to see the web searches from the framework. So we're already seeing some interest from, we're not sure where the little dot is, if that's someone on a cruise ship, but particularly across Canada, the framework's starting to make its way, and see some interest in Mexico. And hopefully our colleague on the line from New Zealand will download it today so we get our New Zealand dot. But been very interesting to see how the framework is traveling. And I would say it was done as quite a soft launch. So this is probably one of our bigger examples. We were just in the middle of an election period in British Columbia, so it's up on the website, and now we're really starting to get into that collaborative action planning phase. So again, I'm going to hand it back over. I think that was my last slide to NCCD, but we're hoping you can promote the framework, or there might be one more slide on where to find it, I think. Perfect, there it is. So it is available for everyone to download. I think Jonathan's been putting it in the chat, and you're able to see to use it as you would. We also have worked on a number of knowledge translation materials. So we have, if you're in BC and you're not already have access to the SharePoint, please reach out to us, because we do have PowerPoints for you. We've got pullouts of the ecosystem. We've got posters, all of that. So if you're at a local public health unit and you're wanting to have access to things, we'd love for you to have it.
Thank you again to our partners at the Ministry of Health in BC. Great job and great work. It's just amazing to have this as a foundation. I live in BC, and I appreciate having this as a foundation for all the work that's going on there. I'm going to drop a link into the chat for an upcoming NCCDH webinar on to continue this conversation around health equity frameworks. So please sign up for that if you're interested. You can see on the screen how to connect with us and learn more about our work and around the frameworks or anything else. And I think that's it. So thanks everybody for all the work.
Thank you.